My name is Gordon McInnes, and I work here at Carolina Beach Counseling in Carolina Beach, North Carolina. And we're going to talk today a little bit about treating depression in children and adolescents. Depression in children is a real serious issue. Also, you look at the same kind of symptoms. Okay, you look at the same type of stuff. How are they eating? How are they sleeping? How is their behavior in what's called different domains, like at home, with their peers, and at school? So you look at these different areas in their life, just like you would with an adult. You'd look at their relationship, maybe in their marriage, or in their personal relationships, at work, within their family, that kind of thing. Kids, though, don't do depression like adults do depression. They do it a lot differently. With an adult, when you think about somebody who's depressed, you may think about somebody who's tearful, have a hard time getting up out of bed, they want to sleep all day long, that kind of thing. They just want to withdraw from themselves. Children frequently are irritable, grumpy, oppositional, can't concentrate, don't want to do schoolwork. Everything is boring, to them. You hear that a lot, and a lot of times that's related back to depression. Also with kids, you don't necessarily want to load them up with a bunch of medication, A lot of antidepressants, especially in teenagers, can actually enhance suicidal thoughts. That doesn't necessarily mean that it enhances suicidal behaviors, but they may have more suicidal thoughts, may thoughts about self-harm, that kind of thing. Kids also don't like to be labeled as depressed. Most adults don't like it either, but kids really don't like to be labeled as depressed. And depression in children looks like a lot of other disorders. So ADHD can look like, or attention deficit hyperactivity disorder can look like depression. Traumatic stress disorder, some child who's maybe been abused or has witnessed abuse or have been in dangerous situations, whatever those may be, can have some depressive features. Oppositional defiant kids, just kids who don't want to follow the rules, can look a lot like they're depressed. So I think it's really important to take your child to somebody who's qualified to look at them, to ask the right questions, and to hopefully identify depression. The other thing with children and depression, at least as far as treatment goes, is that what I found is that you got to do a lot of rapport building. You got to really build up that rapport with kids, and a lot of times it's not real direct. You do a lot of indirect work with them, and so parents who take their child to a therapist may say, well, they're playing a game. Okay, well, they're just sitting in there playing a game. If you go into my office, I have a bunch of board games and those. Well, a lot of times that's the best way to engage a child, is while you're doing something else. Kids also avoid things really, really well. Okay, so they're going to go hang out with their friends, they're going to go do this kind of stuff, and that's where you may get into some drug and alcohol use, chemical dependency kinds of issues, that kind of thing. And so you kind of have to watch that along with kids, because that's another way that they can show their depression, because they want to avoid or withdraw themselves from the thing that's making them depressed. That's some basic information. Make sure that you go and get some advice from a healthcare professional.